So let's talk about how to examine the peripheral venous system. We've talked about vascular exam with an arterial focus. We're going to talk about vascular exam now with venous focus. Uh, Now, remember our approach is wiper plus IPPA and is script-wise. Now, with that said, in terms of the peripheral examination, examination of the peripheral venous system, it's important to understand that the lower limb has two main venous system, and the most important area to examine is the lower limb. It has a superficial and deep system. The superficial system mainly is around the great saphenous vein, which is medial, and the small saphenous vein, which is lateral. And both of the veins start from the around the ankle and go upwards. Now, with that said, let's get into it. So the script for this examination is standing and sleeping. And the reason is you want gravity to support your examination. Now, with that said, with the patient standing, you want to start with inspection. You want to inspect from three angles. Like I said, this is script-wise, basic technique. There are lots of videos that cover that already on YouTube. Now, once you've done inspection in tree, you want to look for scars, look for pattern of distribution of the veins. Specifically, you want to inspect medially for the great saphenous veins from inferior to superiorly, sort of in a caudocranial fashion, generally by most people. And you want to do that for the small saphenous vein, which would eventually at the popliteal-femoral junction join the great saphenous vein. Then eventually you want to follow that, the great saphenous vein, to the saphenofemoral junction. Now, with that said, once you've inspected, you want to palpate. You want to palpate for differential warmth, tenderness. Differential warmth because there could be inflammation in the vein. And you want to also go across the length. So let's say this is the great saphenous. You want to go across. You want to palpate, feel for differential warmth first. And then you want to palpate across the entire length until you get to the saphenofemoral junction. You want to do that for the other, the small saphenous vein until you get to the popliteal-saphenous junction. So that's what you do with palpation. You're feeling for the thickness and all of that. Usually, a lot of people would also advise that you feel for the dorsalis pedis artery as well as the posterior tibial artery, especially if you would do the tourniquet test, which I will describe later. You want to feel for edema. As you're doing this, you're comparing with the other limb. Yeah. Now, once you've done that, you want to also feel across the vein with the bell of your stethoscope for brew and things like that. Now, once you've done that, you probably need to ask the patient to lie down. I don't know why the patient is standing. You want to carry out the tap test. So what you're doing in the tap test is, now let's say this is my hand. You put one of your finger there and then you tap. So you put your finger above, you tap. If there's incompetence, because veins generally shouldn't transmit pulse, you feel it on this side, on this finger. So when I tap that way, I would feel it on this finger. So that means the tap test is positive. Now, once you've done that, the other thing you would do is you go to the saphenofemoral junction and ask the patient to look away and cough, just the way you do in a hernia. If there's saphena varix, you feel cough impulse there. The saphena varix is usually at the saphenofemoral junction, which is 4 centimeters below and lateral to the pubic tubercle. Now, so demonstrated tap test, demonstrated cough test. Now, the next thing you want to do, you want to ask the patient to lie down. So let's say this, and ask the patient to raise their legs up. You help them raise the leg. You now drain, you drain that like that, and then you do this. This is the tourniquet test. Yeah? And you tie that way, and then you ask the patient to stand. Yeah, so you can see the tourniquet. So you ask the patient to stand, and you check whether you can see the drainage. You check whether you can see drainage. If you can see drainage, it means because this is tied around the saphenofemoral junction, it means the incompetence is below this level. If you can't see drainage, it means it's above this level. So that's the tourniquet test. When you use your hand, it's the same test, but that's more like the occlusion test. So that demonstrates the tourniquet test. Now, once you've done the tourniquet test, the other common test that people do is what is called the Perthes test, which is similar. You go the same way, but in Perthes test, what you're trying to demonstrate is whether there's a connection between the superficial and deep venous system. And what you do is you do the same thing. You tie that, and you ask the patient to do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And if there's a connection, there would be the varicose veins will be less prominent. So generally, these are this is what is expected in a peripheral venous system examination generally for varicosity. Now let's recap. So the first thing you want to do is you want to wiper plus IPPA. And our script is standing and sleeping. And you want to inspect and then palpate for temperature along the entire 2 venous superficial system. You want to also feel the pulse and check for pitting pedal edema. In percussion, you want to do the percussion or the tap test. And then you want to auscultate for brewery. And then you want to carry out special tests like the cough test. You want to also carry out the tourniquet test, Perthes test, and in most clinics, you would also do a Doppler imaging as well. Thank you for listening. Please subscribe, like, share, and follow the channel.